Stress and anxiety attacks can be triggered a wide variety of things consisting of stressor, financial problems, relationship problems, bereavement, medical conditions, and medication. However, similar to any medical condition, there is normally more than one cause, a few of which can be related. When a medical professional is attempting to figure out the reasons for a patient's anxiety attacks, he will evaluate environmental problems, characteristics in the person's personality, the client's brain chemistry, any previous traumas, and the family medical history. First of all, the ecological concerns might consist of hardship, childhood, parental separation, excessively stringent parents, extremely important moms and dads, excessive family disputes, afraid moms and dads, nervous parents, and a lacking support group. Secondly, personality type can include a feeling of absence of power, seeing the world as threatening, basic low self-esteem, confidence, and the inability to cope with daily things. Third, brain chemistry can include neurotransmitter imbalances, serotonin, epinephrine, GABA, and so on, and unusual levels of cortisol, tension-type hormonal agent. Furthermore, household case history can reveal a pattern of abuse, substance and disorders, mood, stress, and anxiety, etc., throughout generations, which reveals some genetic personality towards the stress and anxiety attacks. Fifthly, previous injuries can have a significant effect, consisting of childhood events, the most damaging, abuse, natural catastrophes, criminal activity, and war. Once the cause has been determined for the anxiety attacks, the medical professional will try to make a diagnosis. Nevertheless, if the fifth most common causes are not activating the stress and anxiety attacks, then the doctor will take a look at these other possibilities. Hypoglycemia can set off anxiety attacks under certain medical conditions. Thyroid conditions can set off anxiety attacks under particular medical conditions. Sleep disorders can set off anxiety attacks under certain medical conditions. Adrenal disorders can activate stress and anxiety attacks under certain medical conditions. Diabetes can activate stress and anxiety attacks under certain medical conditions. Asthma can activate stress and anxiety attacks under particular medical conditions. Migraines can set off stress and anxiety attacks under specific medical conditions. Epilepsy can trigger anxiety attacks under particular medical conditions. Particular heart conditions can activate anxiety attacks under particular medical conditions. Other psychiatric health problems can set off anxiety attacks under particular medical conditions. Caffeine, other stimulants, can trigger stress and anxiety attacks under particular medical conditions. Drugs, heroin, cocaine, amphetamines, can trigger anxiety attacks under particular medical conditions. Over-the-counter drugs such as anti-inflammatories, cold, cough decongestants, can activate stress and anxiety attacks under specific medical conditions. Steroids, cortisone, prednisone, etc. can set off anxiety attacks under particular medical conditions. Weight loss drugs can trigger stress and anxiety attacks under particular medical conditions. Birth control medicines can activate stress and anxiety attacks under particular medical conditions. Thyroid medications can trigger anxiety attacks under particular medical conditions. Inhalers, respiratory medications, can set off stress and anxiety attacks under particular medical conditions. Natural products can trigger stress and anxiety attacks under particular medical conditions. High-low blood pressure medications can activate anxiety attacks under specific medical conditions. Alcohol withdrawal can trigger anxiety attacks under specific medical conditions. Ritalin can activate anxiety attacks under particular medical conditions. Adderall can set off stress and anxiety attacks under particular medical conditions. Dexedrine can activate anxiety attacks under particular medical conditions. Benzodiazepines withdrawal can set off anxiety attacks under particular medical conditions. Ulcers can trigger stress and anxiety attacks under specific medical conditions. Hypertension can activate stress and anxiety attacks under certain medical conditions. Asthma can trigger stress and anxiety attacks under particular medical conditions. Persistent lung illness can set off stress and anxiety attacks under certain medical conditions. Apnea, sleep apnea, can activate stress and anxiety attacks under particular medical conditions. IBS can set off anxiety attacks under specific medical conditions. Chronic headaches can set off stress and anxiety attacks under specific medical conditions. Persistent obstructive pulmonary disease can activate stress and anxiety attacks under particular medical conditions. prolapse of the mitral valve, can activate anxiety attacks under particular medical conditions. Chronic fatigue syndrome can trigger anxiety attacks under certain medical conditions. Similar to any condition, anxiety attacks have causes and triggers. You might just have suffered from one cause or similar to lots of individuals, had the burden of many. However, the only method to deal with stress and anxiety attacks is to look for medical aid and get treated. Anxiety attacks are not a mental health concern, however, could become so if you leave it to fester. Speak with the one individual you can trust and do not repent, as you are certainly not alone. Click the link below if you would like to help with your anxiety and finally get the peace of mind you have been looking for.